I am Dr. Rahul Roshan, and I am a senior consultant in Department of Respiratory Medicine at BLK Max Hospital. Overcrowding, it's a definitely proven risk factor leading to increased incidence and prevalence of the TB patient. See what happens in an overcrowded place, a person to person transmission of tuberculosis, especially pulmonary tuberculosis of the sputum positive patients, it is much higher. Okay, so if a one person is affected, then the other persons are bound to get affected. And if you look at the pollution index, suppose in Delhi, we are living in Delhi. So in Delhi, you can see the AQI is all most of the times of the year it's more than 200. So again, this pollution, it leads to decreased immunity of our respiratory system. The defense mechanisms gets hampered, and therefore tubercle bacilli, it can easily break into our immunity system and lead to tuberculosis. So definitely, it's the pollution is going to increase the prevalence of a tuberculosis. Definitely, it's of a paramount importance. If you train the health professionals properly about how to manage a tuberculosis patient, how to diagnose a tuberculosis patients, what we see nowadays, for example, the most of the MDR TB patients, they are due to inadequately treated TB. For this, both are responsible, the patients as well as the doctors. So therefore, if the health professionals are well trained, they know when to start a anti-tubercular treatment, when to stop anti-tubercular treatment, what are the parameters for which we want to see in the follow-up. See, that guidelines are well defined about the treatment. So if they know well about the guidelines, the compliance of the patient will be adequate, and the response of the treatment will be good. Therefore, it is very important to train the health professionals. It's a time to know when we should suspect of a tuberculosis in such patients and when to start the treatment. So that's of very paramount importance. It's very important, especially to reach a general population. It's important to create an awareness program. It can be done with the social media. It can be done with the help of a print media, with the help of the newspaper, with the help of the different small camps in the societies, in the slums, especially in the backward areas, to get them aware that when should you consult a doctor, what are the symptoms. Suppose you have a fever and cough for 2 weeks, so then you should go and consult a doctor. You can have a tuberculosis. So make them aware of these symptoms, make them aware that if there is a positive patient of tuberculosis, so then they should know that he should live in a separate room or should be in isolation so that other people don't get affected. So therefore, it's very important. If a patient is diagnosed to have a tuberculosis, one can have a telephonic inquiry about the patients intermittently. Okay, you can give them a helpline number so that if any problems come during the treatment of tuberculosis, they can contact you. They should not stop the tuberculosis medication. So that is very important.